Hi, I'm Dianne Grote Adams with Safex. I'm one of the industrial hygienists here, and we've received a lot of questions about face coverings, masks, respirators, and people seem confused. So we decided we thought it would be a really good idea maybe to talk about the differences, what they're designed for, what you might consider purchasing, and the reasons for doing that. So let me start with a face piece, or a face covering. This is a cloth face covering. You can see that it expands, and when worn, it will cover my nose and mouth. You might find them with strings to tie in the back, or you might find them with ear loops that go around your ears. But these cloth face coverings are designed to prevent you from exhaling anything into the community or onto people that you might be in close proximity to. We know that right now during the COVID-19 pandemic, we are concerned about spreading the virus. The virus travels on respiratory droplets that we exhale. So by wearing this face covering, we are containing any droplet we might exhale when we're out and about. So this is going to protect us from spreading disease, not protect us from anything that we might be inhaling. These are not tested to say that they're going to filter out small particles. They're merely going to contain our respiratory droplets and therefore the virus that's contained in them. They are only to be used in addition to social distancing, the use of barriers, and frequent hand washing with soap and water. And of course, if you don't have access to soap and water, you can certainly use a hand sanitizer. The second product that we're going to talk a little bit about today, the face covering, is a surgical mask. Many of you have probably seen these when you've gone to the dentist or perhaps had a minor medical procedure. Surgical masks also expand. They cover the nose and the mouth. They might have ear loops like this one, or they might tie like the face covering I showed you. So what does a surgical mask do? A surgical mask is designed to keep my exhaled air off of my patient. So similar to a face covering, they are protecting those around me. So when I exhale as a dental hygienist or a med tech, I'm not breathing on you, the patient. They also have a slight moisture barrier, so if there were a splash of something during our procedure, that I would be protected from that splash. So that's a surgical mask. How is that different than some people call these masks? Well, this is an N95 or a filtering face piece. These are actually respirators. These are tested by NIOSH to make sure that they are effective in reducing any air contaminants that are in particle size outside my mask before it enters my breathing zone when worn properly. They are also worn over the nose and the mouth, but they have to be fitted properly to make sure that I have a good tight seal around my face to make sure that air doesn't leak in and the air filters through the filtering face piece, the N95 respirator, and then that way the air that I'm breathing inside is clean. So this is different. These two products are different, N95s, than the first two products that we talked about, and that these are designed to protect me, the wearer, from things that are outside that might come into my breathing zone. If you wear or are required to wear a respirator, a filtering face piece, then there are OSHA regulations that apply, and they include having a written respirator program, making sure that the people that are going to wear these respirators are clean shaven. They must also be medically cleared to wear the respirator and trained properly. The final thing that I want to talk about is a combination filtering face piece and surgical mask. These are limited right now, especially to the healthcare industry, but they both protect the wearer and the patient with one product. So you can see these are very much needed for our first line defense healthcare operators right now and not generally going to be used in manufacturing or in construction or in office settings. All of these products are designed to protect and limit the spread of the COVID-19 virus, but they all do it in a slightly different way. So it's really important as we select what product we're going to purchase to understand what it is you're trying to accomplish. All of these products need to be cleaned or disposed of properly, and the people wearing them need to understand the limitations and the restrictions. We also want to make sure that we're using good hand hygiene, washing our hands frequently, using sanitizers so that we don't handle a dirty mask or a dirty face covering or a dirty respirator and then transfer that back to my face. So really important, I think, no matter what you choose, is to understand what it is you're trying to protect against, so which is the best product, and then make sure that those people that are going to be wearing it understand the limitations and are trained properly to handle them, dispose of them, and keep them clean. If you have questions, it's really important, talk to your health and safety person or reach out to us here at Safex and we'll be happy to guide you. Stay healthy and have a safe day.